Alright everybody, this is TJ. I'm getting ready to do the in-service for the Myosure and Aqualex case that you have on Monday with Dr. Crowder, but I wanted to make sure everybody was comfortable with the entire setup of everything. So first and foremost, you're going to have the Myosure scope. You'll pull it out of the tray and you're going to have use of these 5 pieces. The scope, the outflow channel, 2 end caps, and a light cord adapter if needed. Once you open the scope, you're also going to pull out a pack of disposable seals, which have been left here at the front desk. In that pack, you're going to see 2 little white seals that look like this. These seals will come out of the pack sterile and will go into the scope in 2 locations. First seal is going to go dome side down into the scope, and we'll get a metal cap over the top of it. Following that, the outflow channel will then go into the scope. We'll have another white seal will then go into the outflow channel and will be covered by a metal cap. Once this is set up and you use your light cord adapter if necessary, you'll be ready to go with your tubing. So next, with your tubing, you'll set up your outflow tubing like you normally would. You'll have one outflow tube that will go from the outflow channel of the scope, which is this channel, and will be cut and put into the drape like you normally do your outflow. The inflow channel will go into the inflow of the scope and will be provided also at the front desk in this package. You see it has a blue lower lock end and spikes. When it comes out of the package, this is what you'll be looking at. Next, we're going to hang a 3,000 cc bag of saline. Just going to hang, the pole doesn't go up or down any further than what it is right now. And we're going to prepare to get the tubing hooked up for the procedure. Tubing will stay sterile. We'll follow the directions that are on the machine. Right now it says insert tube set. We'll take the tube set, which is this set, less tangled, out of the pack. Blue is going to stay on the scope with the scrub tech, and will go on to the inflow channel of the scope. Blue to the in channel of the scope. The rest of the tubing is then going to come off to the circulator, who's then going to insert everything into the pump. So it says insert tube set. At that point, you're going to take the tube set, you're going to take the big white head on the tube, we're going to slide that in so we have arrow to arrow. You'll hear it beep. You're going to stretch this straight around, make sure that there are no kinks, and then you're going to be able to go ahead and spike your bag. You'll spike your bag, open your tube, and then you'll take a look at the machine and it should say press prime button. When the physician's ready to start the case, before the scope is inserted into the patient, we need to make sure we go through our prime and calibration process. The physician is then going to open their inflow fully, hold the scope over the bag, and you're going to press the prime button. So in this case we don't have any fluid, but I'm going to go ahead and go through the process anyway. The scope will be over the bag, fluid will be coming out. You'll see the bubbles disappearing, but you'll also see the pump will stop and spit and then start again. So it's pressurizing to understand the scope size that the physician is using. This process typically takes about 15 seconds. When it's done, you'll hear a beep, and if you look at the machine, it will say prime successful, close stopcock. After about 3 seconds, it will say pump operating. At this point, it's going to allow everything that was put into the bag to be sucked back into the canister. And you're going to press and hold the prime button until you see it go, or the 0 button until you see it go to 0. From that point, the physician's ready to go ahead and do the procedure. If they need additional inflow pressure, intrauterine pressure, simply hit the up arrow on the machine to give that additional pressure. Other than that, that is it. When they need to do Myosure, I'm going to pause this. If they need to do Myosure, the outflow channel will come and be removed fully out of the scope. The Myosure handpiece will come out of the bag and be inserted into the bag into the scope. At this point, the circulator will take the green end, which will be much longer than this, and we'll plug it into the Myosure machine until it clicks. The additional tube will then go down to the tissue collection sock and be put on there. Understand that when you put pressure down here, it's going to automatically go to pump pause for container change. That's perfectly normal. Once you put your pressure on and you put your tube on, you're simply going to hit the pause resume button. Everything will be back in operation. The deficit will be accurate for your positions. Physician then will step on the pedal to do the Myosure procedure. When you're finished, you can simply allow everything to drain out of the bag. Pause that, get your deficit, and the procedure is over. That's good.